American newspapers had reported on the sorry state of affairs that Indian doctors have to encounter while working in Indian hospitals and Indian medical colleges. So I felt it is only appropriate for me to talk about a rather unfortunate turn of events that has been highlighted in one of the most prominent American newspapers talking about American young doctors. Dr. Nakita Mortimer was always a leader, the first of four children to move to the United States of America from Haiti for college in 2012. She was a guiding light for each sibling as they followed her. In her medical residency in anesthesiology at Montefiore Medical Center in the Bronx area of New York, she helped organize a union for residents. She wanted relief from the punishing hours and pressure that challenge even the high achievers who become young doctors. The fact that the medical profession has one of the highest rates of burnout and suicide compared to other professions speaks to the urgent need for change, Mortimer told the City, which is a local news site, in November 2022. Months later, she died by suicide. Her death was a reckoning for her peers, as many young doctors are pushing for more mental health support and improvements to their working conditions. The fact that I never thought that it could be her means that it can be any of us, said Dr. Jory Hodge, a medical school classmate. Nakita has always had a fire. The end of a young life with so much promise amplifies suicide's universal tragedy. Any individual suicide's cause is, finally, unknowable, but a number of suicides among medical residents have fueled calls for hospitals and regulators to better support young doctors who say their well-being is at risk. Nearly 25% residents have considered self-harm and a fifth know a peer or colleague who has considered suicide in the past year, according to a 2024 survey by the Physicians Foundation, an advocacy group in the USA. Current and former residents said they hesitated to ask for help or use mental health resources for fear superiors would consider them unfit for the high-stress profession of being a doctor. Some said they had suicidal thoughts for the first time during residency. The Dr. Lorna Breen Heroes Foundation, named after a New York emergency room director who died by suicide in 2020, has helped push 34 state medical boards and more than 500 hospitals to remove questions about mental health history from doctor licensing and credentialing applications. There is a minefield of institutionalized stigma, said Corey Feist, Breen's brother-in-law and co-founder of the foundation. Older doctors and hospital administrators consider residencies trials a vocational rite of passage. There is a question dividing the medical practice right now. Is being a doctor a job or a calling? For decades, the answer was clear. Doctors accepted long hours and punishing schedules, believing it was their duty to sacrifice in the name of patient care. They did it knowing their colleagues prided themselves on doing the same. A newer generation of physicians is questioning that culture, at times to the chagrin of their older peers. Dr. Jefferson Vaughn, 63 years old, has worked as a surgeon at Jupiter Medical Center in Jupiter, Florida for 30 years and is on call for the emergency room 5 to 7 nights a month. He says he shares the duty with a handful of surgeons around his age, while younger colleagues who practice more specialized surgery are excused. All of us old guys are taking ER call, and you got guys in their 30s at home every night. It's just a sore spot. Nearly 50% of doctors report feeling some burnout, according to the American Medical Association. Work-life balance and predictable hours should not be at odds with being an MD, say doctors who are pushing against what they view as outdated expectations of overwork. Dr. Cara Grace Leventhal, 40, is a hospitalist, a job that offers set hospital shifts, caring for patients, and the ability to clock out at a fixed time. We have to take care of ourselves in order to take care of other people, says Leventhal. Many in her generation, she notes, are also caring for young children and elderly parents. Changes in healthcare mean a growing number of physicians now work as employees at health systems and hospitals rather than in private practice. Electronic paperwork and other bureaucratic demands add to the stress and make the profession feel less satisfying, they say. More physicians are pursuing temporary work. This debate and its consequences will play out for years. In interviews with nearly 24 physicians, many said that medicine's workaholic culture was overdue for a correction. Others said when physicians are less committed to their work, their peers and overall quality of patient care can suffer. Physicians in America work an average of 59 hours a week, according to the American Medical Association, and while the profession is well compensated, the average physician makes 350,000 American dollars. A recent National Bureau of Economic Research analysis found it comes with high pressure and emotional strain. When Leventhal started her current job at Johns Hopkins Hospital in Baltimore in 2021, she says a superior told her sick time could be used only in extreme circumstances. For example, if she had been in a car crash on the way to work. It was a familiar mindset. When pregnant during her residency, she nearly skipped a scan. Leventhal was due to present patients to her attending physician and did not want to draw more attention to myself being a mom. She says she made it to her appointment, then was rushed to an emergency C-section that day. Her obstetrician said that had Leventhal not come for the scan, she would have lost her daughter. Leventhal and her peers at Johns Hopkins lobbied to change their sick day policy, and now she says doctors in her group are permitted to take sick time as needed without explanation. Her group, she says, has doubled the number of on-call doctors to cover more absences. The hospital did not respond to requests for comment. In Florida, while working with medical students at Jupiter Medical Center, Vaughn has been put off when they've called out for reasons ranging from colds to bachelor parties. None of those would have been acceptable during his training, he says. I'm not saying they are wrong in their desire for a work-life balance, but there was a time when the patient came first. Jupiter Medical Center said it would continue to embrace the needs of a multi-generational workforce and said that it was deeply grateful to its physicians for their commitment to working together. More young doctors are choosing to join healthcare systems or hospitals or larger physician groups. Among physicians under age 45, only 32% own practices, down from 44% in 2012. By comparison, 51% of those aged 45 to 55 are owners. Owners have more autonomy, but also increasing overhead costs. Vaughn, who sold his private practice in 2011, saw his malpractice insurance premiums increase to $65,000 a year. Dr. Joseph Comfort, 80, sold his anesthesiology practice in 2003, frustrated by rising billing tussles with insurance companies. He now works part-time as an internal medicine doctor at a small concierge clinic in Sanford, Florida. We've been ripped down off our pedestals. For generations, Comfort says, doctors accepted being at the mercy of their pager and working long hours as the cost of doing business. We took it because we considered ourselves to be masters of our own fate. Now everything's changed. Doctors are like any other employee, and that is how the new generation is behaving. They also spend far more time doing administrative tasks. One 2022 study found residents spend just 13% of their time in patient rooms, a factor many correlate with burnout. Dr. Joel Katz, who led the residency program at Brigham and Women's Hospital for 20 years, has seen such attitudes evolve firsthand. For years, doctors often refer to their work as a calling. Among some residents, it is now considered very triggering and offensive, says Katz, 66, who recently became Senior Vice President for Education at Dana-Farber Cancer Institute. It's code word for being taken advantage of. Today's cohort understandably feels more like widgets in a system and is inclined to use benefits such as sick time, he says, but doing so can pose challenges for patients who may end up with less consistent care. In San Francisco, Dr. Christopher Domansky, a first-year resident who had his first child earlier this year, says he is interested in pursuing a 4-day work week once he's completed his training. I'm very happy to provide exceptional care for my patients and be there for them, but medicine has become more corporatized, says Domansky, 29. Though he is early in his medical career, he has heard plenty of physicians complain about needing to argue with insurance companies to get their patients the treatments they need. It's disheartening, he says. Residents' work and rest hours have been subject to increasing regulation by the Accreditation Council for Graduate Medical Education, whose guidelines state that they can work up to 80 hours a week in shifts as long as 24 hours. Such rules have helped foster more of a shift mentality among younger physicians, says Dr. Maria Ansari, Chief Executive of the Permanent Medical Group and the Mid Atlantic Permanent Medical Group. They have a different mindset and approach about protecting their personal time, she says, noting that the groups she leads have seen a jump in young physicians interested in virtual work. Such hires now account for around 10% of new recruits a year. Ansari 55 says she applauds efforts to stop sleep deprivation among doctors, especially since it can lead to medical errors. Yet, it is harder to replicate her generation's learning experience, she says. A lot of my learning came in the wee hours of the morning and following that patient for 45 hours. A lot of crises happen after hours. New technology has the potential to promote physician well-being, she says, noting that the 24,000 physicians across all permanent medical groups were given access to artificial intelligence tools this summer. The software helps transcribe conversations with patients and can reduce time physicians spend completing electronic notes. That is important, says Dr. Mary Leung, 47, an oncologist on Long Island, New York, who also works as a life coach for burned out doctors. A lot of physicians feel like they're charting machines or clickers, she says, adding that many wind up doing paperwork at night because they don't have time during the day. Dr. Christopher Wassink, a 58-year-old anesthesiologist in Naples, Florida, says lately he has seen more young doctors seeking 3 or 4 day schedules. It can make covering nights and weekends more difficult, he says, and he and his peers privately wonder if it takes a toll on young practitioners' competency. Still, the father of 4 says he understands where they are coming from. For most of his career, he's regretted becoming a doctor. In 24 years, he never called in sick, mainly out of guilt. I am sympathetic, he says. I don't think you should spend your life at work, no matter what that work is. After medical school, doctors are expected to work 80-hour weeks and shifts of up to 28 hours for several years to earn board certification in the United States of America. The relentless schedule can drive depression, burnout, and suicidal risk, said Dr. Srijan Sen at the University of Michigan. His research documented a 5-fold increase in rates of depression during the first year of residency compared with the end of medical school. Other professions, including banking and law, demand relentless commitment of young people lured by big salaries. In those fields, relatively high pay starts right away. First-year residents made an average of 67,000 American dollars in 2024 while carrying an average of 200,000 American dollars in debt. Families of residents who have died or attempted suicide say the system puts too much strain on young doctors. It is incumbent upon us to completely change the way we look at mental illness in our profession, said Dr. Richard Boulay, a gynecologic oncologist whose daughter attempted suicide during general surgery residency in 2021. The Accreditation Council for Graduate Medical Education requires programs to provide residents with confidential mental health services, encourage them to report concerns, and allow time off for illness, family emergencies, medical appointments, and parental leave. ACGME is assessing how to ensure residents can report poor working conditions without fear of retribution, said Chief Accreditation Officer Dr. Mary Klingensmith. We do not want it to be that residents feel hindered in any way from speaking their truth, Klingensmith said. Nakita Mortimer's death shook her fellow residents at Montefiore. We could all kind of see ourselves in her, said Dr. Jessica Mitter, a first-year resident when Mortimer died. The program's union, which Mortimer helped organize in March, approved its first contract, including an 18% salary increase. Montefiore offers mental health support, including check-ins with first-year residents. It was clear she was an exceptional leader and compassionate physician dedicated to making positive change for all. Montefiore's anesthesiology department wrote on X after her death. In medical school, Mortimer belonged to a group called White Coats for Black Lives. Her classmates admired her willingness to raise concerns with superiors and her reliability as a friend. Scattered around the country as residents, Mortimer and her classmates stayed in touch in group chats and convened in one of their new homes when they could. Dr. Rahima Thomas, a friend from medical school, completing residency at MD Anderson Cancer Center in Houston, spent time with Mortimer in New York when Thomas interned there in 2022-23. Mortimer and Thomas coordinated their schedules to make slivers of time to go dancing to Afro beats and Caribbean music. She was just very light-hearted but also had a lot of depth to her, Thomas said. Mortimer's sister, Sarah Jane Mortimer, said the family heard from her less often after she started residency. She missed weekly calls with her siblings and followed up after rotations or catching some intermittent sleep. In May 2023, she missed a flight to Sarah Jane's graduation from Harvard School of Design. The family asked Montefiore staff to check her apartment in resident housing, where Sarah Jane said they found Nakita asleep. "You are tired from your rotation," her parents told her on the video call. "We understand if you can't make it." Nakita texted her sister congratulations on her graduation. "Within about 24 hours, we lost her," Sarah Jane said. The problems facing the medical profession are universal. It's not just restricted to one country or one kind of work culture. While I understand that medical professionals need to work harder than other professionals because our profession saves lives, and if we don't do our work properly, it may even lead to the loss of lives. But a balance has to be struck. A line has to be found where we are not killing ourselves in our efforts to save other people's lives.